Hello, my name's Arti Bansal and I'm going to talk you through this introduction video to this high quality and low carbon asthma toolkit. This toolkit's been reviewed and approved by the NHS England and NHS Improvement Inhaler Working Group, and it's been written for the use of GP practices to bring together the aims of improving outcomes for asthma patients whilst also reducing carbon emissions. It aims to give practices a framework for thinking about quality improvement, as well as step-by-step practical tools for quality improvement implementation. Let's start with the state of asthma care in the UK. The UK has one of the highest mortality rates from asthma in Europe. Asthma UK estimates that 2/3 of patients are not receiving basic care. And in 2014, the National Review of Asthma Deaths estimated that 2/3 of the UK's asthma deaths are preventable. What's this got to do with the climate crisis? Well, we're all aware that we need to act on the climate and ecological crisis, and that all sectors of society urgently need to reduce their carbon footprint. The World Health Organization has said that climate change is the single biggest threat to humanity. The climate crisis is also a health crisis, and this slide shows some of the health impacts that threaten to undermine all the progress made in public health over the last 50 years. However, the benefits to climate action on health are significant, immediate, and in line with what we would do to improve health, even if there wasn't a climate crisis. The NHS in England contributes 5% of the UK's carbon footprint. In October 2020, Greener NHS was launched as the NHS became the first healthcare organisation to commit to becoming a net zero health service to protect our health now and in the future. One of the NHS's carbon hotspots are pressurised metered dose inhalers, the most commonly prescribed inhaler for respiratory conditions in the UK. As part of the NHS England commitment to net zero healthcare, we're being asked to reduce the carbon footprint of inhalers by 50% this decade. This reduction brings us in line with other European countries that use fewer metered dose inhalers. There are large differences in the carbon footprint of different types of inhalers. The inhaler at the top of this slide is a pressurised metered dose inhaler, sometimes called an aerosol spray inhaler or a puffer, and it uses propellant gases in its canister to deliver medicines to the lungs. These propellants are powerful greenhouse gases with approximately 1,000 to 3,000 times the global warming potential of carbon dioxide. This is the reason why inhalers are estimated to make up 3% of the entire carbon footprint and 13% of the direct carbon footprint of the NHS. Dry powder and soft mist inhalers, such as the one at the bottom, do not contain these propellant gases, and so their carbon footprint is much lower. This image gives us a more detailed illustration of the difference in carbon footprint between the metered dose inhalers represented by the blue bars and the dry powder and soft mist inhalers represented by the yellow bars. But you can see that there are also variations in the carbon footprint of different pressurised metered dose inhalers depending on the type of propellant used or the volume of propellant used. You can learn more about this in video 4 on device choice. In the UK, 70% of the inhalers used are pressurised metered dose inhalers, and this is a much higher proportion than our neighbouring European countries, who use a higher proportion of low-carbon, dry-powdered inhalers. In Sweden, only 13% of inhalers are metered dose inhalers. As you can see, there is no correlation between the type of inhaler prescribed and asthma mortality at a population level. Furthermore, the majority of inhalers used in the UK are short-acting beta agonist inhalers, the blue reliever inhalers, and over-reliance of these inhalers, 3 or more in a year, is common and is associated with poor outcomes. You can learn more about this in Education Video 3 on disease control. So we know we're prescribing more reliever inhalers than preventer inhalers, but this is the opposite of what we would expect if our asthma patients were well controlled. We would expect 3 to 6 preventer inhalers a year and no more than 2 reliever inhalers a year. We therefore know that improving asthma disease control can have a very significant impact on patient outcomes, inhaler prescribing, and our carbon footprint. The causes of poor control are multiple and complex, but it is worth remembering that critical errors are very common with inhaler technique, as is low adherence to preventer inhalers. This results in poor outcomes for patients and increases the overall carbon footprint of respiratory care due to increased healthcare utilisation. When we're thinking about device choice, the greenest inhaler is the one the patient can and will use. The different type of inhaler devices require different techniques, and not all patients will be able to use either of these devices. Most patients can use the technique needed for a dry powdered inhaler and may prefer it. You can learn more about this in video 4 on device choice. What about inhaler disposal? Many metered dose inhaler users are unaware of how many doses their inhalers contain, as they may not have a dose counter, and often metered dose inhalers are disposed of when they're half full. This graph shows some data from a GSK recycling scheme in Scotland, which has unfortunately now ended. A few pharmacies still have access to recycling of inhalers via a TEVA-sponsored TerraCycle scheme or a postal Chiesi scheme. However, if inhalers are disposed of in household waste and end up in landfill, then the propellant gases are released into the atmosphere, contributing to climate change. Where inhaler recycling schemes are not available, patients should still be advised to return their used inhalers to the pharmacy for safe disposal of the propellants. You can learn more in video 5 on disposal. As you can see, high quality and low carbon care are inextricably linked. This guide, which you will find in the introduction section of the toolkit, gives you a framework for how to reduce the carbon footprint of inhalers and principles for doing this safely and effectively. The framework is to start with optimizing care, offering low carbon inhalers as first choice where they're clinically appropriate, considering how to reduce the carbon footprint of metered dose inhalers where they're needed by choosing the brand and regime with care, and asking all patients to return unwanted and used inhalers to their pharmacy. The principles are to find the right medication and device for each individual as part of a shared decision-making process. Assess inhaler technique at every opportunity and follow patients up to ensure suitability of devices and disease control. Make sure you don't undertake blanket switching of devices or if a medication is changed. The new Primary Care Network DES contract investment and impact fund indicators that start on the 1st of April 2022 have targets that look at both improving asthma care and reducing the carbon footprint of inhalers. The targets around improving asthma care look to improve adherence with preventer inhalers and reduce reliance on reliever inhalers. The targets around reducing the carbon footprint of inhalers look to make sure that we are using those inhalers which may have a lower carbon footprint but have the same medicine, such as certain types of salbutamol inhalers, and also making sure that we offer people low carbon options. In order to help practices deliver high quality and low carbon asthma care, we first mapped the opportunities for quality improvement work. These opportunities occur at first presentation of symptoms, when a patient requests their inhaler, during medication review, annual asthma review, and if a patient has needed to attend hospital or indeed their practice with an exacerbation. The whole practice team is involved in this process of care. And therefore, successful quality improvement will require a whole team approach. We've divided the projects into 4 areas. Each project area has an education video to support you with the essential clinical knowledge you need to implement the projects. The projects help you think about how you can improve the processes of care in your practice, or they involve searches to identify patients who may need their care reviewed. Some projects are really quick and easy. Others will be an ongoing process. We've explained where the projects can help you achieve the investment and impact fund indicators. We've done our very best to make sure that the projects are as step-by-step as possible. We've included many of the resources you need, such as downloadable searches, pre-written text messages, as well as patient-facing resources such as leaflets and videos. And we've linked into existing resources from Asthma UK and the Primary Care Respiratory Society as 2 examples. We've also created a written resource with an accompanying video on how to approach consultations with asthma patients in an integrated way that looks at both disease control and device choice, be that at their annual review or opportunistically. We hope this toolkit is an enabler of high quality and low carbon asthma care, and we welcome feedback to improve it. Thank you.